Welcome, everybody, to our Spotlight series, which is designed to highlight true neurology heroes who, through their actions, exemplify the values of the American Academy of Neurology. I'm Dr. Jim Stevens, president of the AAN, and today it gives me great pleasure to speak with Dr. Linda Wendell and Dr. Brad Thompson, a married couple from Rhode Island who are both neurointensivists at Brown University. Welcome, Linda and Brad, and please share with us your inspirational story, what actions you took as a result of the COVID-19 pandemic, and perhaps a few lessons that you learned from the experience. So please share your story with the group.
Thank you for having us. When the pandemic first started, I don't think anybody really knew how big this was going to be. We knew that there was a virus. We knew that it started in Wuhan, China, and it was spreading to Europe, and it became obvious that we were going to start dealing with patients who were also sick from COVID-19. And so there was a lot of preparation before we actually started taking care of the COVID patients, and Brad was really involved with a lot of the preparation for our neurocritical care unit to turn into a COVID unit. I'll let you start to tell that part.
Yeah, so what happened is we developed plans in the hospital having to do with what happens when we fill the entire medical critical care unit with COVID patients, and then what happens next and what happens after that. And we decided that the best place for folks to go after working through the medical critical care unit and also one of our surgical critical care units was the neurocritical care unit. And I think we spent a long time preparing for that, us, the neurocritical care nurses, and the neurocritical care advanced practice providers, so our team of physician assistants and nurse practitioners, for the potential eventuality of those patients arriving. We thought perhaps it wouldn't happen, but ultimately it came closer and closer, and then we spent about maybe 6 or 8 weeks converting our entire neurocritical care unit into a full COVID ICU, having nothing to do with neurology, which was really a stretch for us all as a team.
I think that when it became more obvious that we were going to become a COVID unit and that we were going to become COVID intensivists, we were all willing to do what we could do to help. We knew that the MICU couldn't handle the numbers on their own, and we honestly were really honored to be chosen to help take care of these patients, that the medical intensivists viewed us as their colleagues and that they trusted us to take care of these patients. And so it certainly was a little scary in the beginning because we didn't have past experience and no one really did. And so I said it felt a little bit like the first days of fellowship where you have really sick patients and you just don't have that clinical experience to know what's going to happen, and you're a little bit unsure of yourself. But as the days went on and we gained more experience, we knew what to anticipate with the patients. Our team really came together. All of the neurointensivists, like Brad said, are advanced practice providers, all of the neurocritical care nurses. And I think another really cool thing about what happened is that we had cardiology fellows rotating with us, GI fellows rotating with us, a lot of other disciplines that we don't generally work with, and we were all together as one team, and that was just a really great experience for us to have because we all knew we were in it together to help people.
I think it shows it's a marker that neurocritical care is in fact critical care, that it was certainly a stretch for us, but it was within our capabilities. And then the one other group that I want to point out is that the neurology and neurosurgery residents, who have always been part of the neurocritical care team, but not the primary folks, at least in our institution, really had to step up because the advanced practice providers were being pulled away to our new COVID unit. And so they had to step up in a new way in the neurocritical care unit, which we also continue to run. And that, I think, was a marker for how important neurocritical care is to neurology and neurosurgery training in general.
Right, right. Our neurocritical care patients were displaced to a different ICU, but we still had them. And so we were, in fact, running a neurocritical care unit that was a little bit smaller than our typical unit, plus this COVID unit. And the neurology residents and the neurosurgery residents were now the primary caretakers.
Well, it's truly a testament to your resilience and commitment to do what you've done and keep everything going. I'm in awe of the amount of effort that must have taken, and I'm so appreciative today for you sharing your story with everybody, Linda and Brad, because your efforts tie so closely with the values of the AAN, particularly the value of professionalism, which is one in where we work collaboratively, as you pointed out, as a committed team to share our expertise and use informed decision-making and service to others to improve the quality of neurologic care. So once again, thank you. And until next time, everybody, stay safe and stay strong.